Hello everyone, this is Dr. Priya Singh. I'm a cosmetic dentist. I have a clinic named Impressionz Dental Care which is in Mumbai for the past 10 years. Today's topic is very vital for the dental success, and that is how do we convince patient for treatment? How do we make sure that every patient which comes in our clinic gets the treatment done? Now, there are 4 types of patients that are going to come to your clinic. The first ones are your old patient or your loyal patients who come to you only. The second are a new walk-in or a referral patient maybe. The third are the sufferers or the complaint patients who have got their treatment done somewhere else and they are not happy with it and they want you to rectify it. And fourth, the very special category, the window shoppers, or as they say, doctor, मुझे सिर्फ पूछना है, दिखाना नहीं है. So let's not concentrate on that category and just concentrate on the first 3 categories and make sure that we get maximum conversion for treatment. Now, why wouldn't a patient get treatment done from you? It's because of 3 main reasons. First, अगर उसे डॉक्टर ही समझ में नहीं आए, they don't have confidence on you. Second, अगर उसे treatment समझ नहीं आए, they are not understanding what exactly are you trying to tell them. And third, अगर उसे पैसे समझ में नहीं आए और he is not convinced that why are you charging the patient that much. So we are going to work on each categories and make sure that we work on that area. First, about the doctor. As I have told you time and again, be welcoming, be smiling, genuine compassion, genuinely interested in the patient's problem. If a patient comes with me with a lot of pain, first I try to manage that pain, maybe by anti-inflammatory or maybe I give a injection to the patient and make sure that his pain is first reduced, because if patient is in a lot of pain, do you think he's actually concentrating on what you have to say? So I work on that. I take a proper medical history and then make sure that I reduce his pain and then I go about my treatment. That is the first thing that I do. So if the patient feels that this doctor is genuinely interested in taking care of me, the doctor is really welcoming, आधा तकलीफ तो डॉक्टर को देख के ही खत्म हो गया. If the patient has those feelings, it's very high chances that the patient would get the treatment done from you. The second is if the treatment plan is not understood by the patient or you were not very convincing about the treatment. So when I take the patient on the chair, I first address the tooth with the chief complaint. अगर आप पहली अपॉइंटमेंट में यू आर ट्राइंग टू शो हिम ऑल द प्रॉब्लम एरिया एंड यू कम अक्रॉस एज अ सेलर, then maybe the patient feels that you are trying to get maximum out of it and would put a negativity in him. So rather than that, do it in the subsequent appointments once the patient has confidence on you or once he feels that a good treatment is achieved. He would सामने से say that what doctor, see if I have anything else to be attended. So do that. When I have to convince him for the treatment, I take intraoral pictures and I show him in those pictures. I take an RVG, show him in that. Maybe give him a mirror, show him the tooth of concern. So first he has to understand where the problem area is. Then I try to tell him what the treatment plan is. I either draw a picture, I show it on my laptop in an animated video maybe. I have a folder in my laptop which has treatment photographs for each department. Suppose I have to sell him a laminate. I have photographs of the laminate. I have a cap quality box which has different type of caps or laminates. I can instantly give it and make him see the difference between a PFM and a zircon. So when the patient sees it, feels it, there's a very high chance that he would get converted for the treatment. I show him on a diphodont what exactly is an implant. If it's a full mouth rehabilitation case, the patient wants to get a full mouth rehab, I take his cast, show him on the cast, make a wax up model, show him on that what all things can be achieved. When these things are done, it's very high chance that patient understands the treatment completely and would eventually get the treatment done. Now, the third part is if he doesn't understand the treatment charge, why is he paying so much? So now patient would either tell you that what doctor, I think you're charging too much, or else he would not say anything. In his mind he feels that what, the treatment charge seems to be a little higher, let me go and check out somewhere else. So in either of the scenario, what I do before that topic should come, when I tell that my treatment charges are this much, suppose if I say about a root canal that I'm charging X amount, what do? I tell him that why I'm charging so much. So I would say my root canal is done in a single appointment. It's done with the best class amenities. Lot of x-rays would be taken in that procedure. It's a computerized, machine based. highly equipped instruments would be used. So when I say that, the patient knows the value for the treatment, he knows why he's paying you, and the patients are genuinely interested in quality treatment. Similarly for the crowns, if I have to sell him a crown, I would add that it's a CAD/CAM quality caps. There are caps which are inferior types also, but I do know that personally. So when you add on these things, when you add value in your treatment, the patient does get the treatment done. And there are a few patients that you would not convince, but there's nothing that you can do about, because I genuinely feel that you should not entertain bargaining and you should stick to the cost according to area or whatever you have decided. If you feel that it's the cost that is worth your treatment, then please stick to it. Now, having said all that, there are patients who are genuinely not affordable. I would make my treatment a little reasonable for them, but I am not going to reduce on the individual treatment. I wouldn't say now, okay, for you I'll make my root canal this much or my crown this much. What I'll do in the overall treatment, maybe I'll reduce a 5% or 10%. What will that do? They should not go out and tell others that, you know what, his root canal charges were this much, but he gave me in this much. So that way, there is a chance that, you know, a bad word of mouth spreads if two people have got the same treatment for different charges. So that is one thing that I do. Also, regarding complaint patients, if you get patients from other doctors where the treatment is not done very well, please do not demean the work of other dentists. Everybody is a learner here and we have to support each other. I firmly believe. Say that I can do better than that. Your problem is this, and I will try to solve it. Don't demean others, because I feel it puts a negativity in the patient's mind also. कि मुझे भी नहीं अच्छा लगेगा कि if somebody else is talking negative about somebody else. You just say what best you can do for the patient and how you can help them. So if you stick to all these, I really feel that it will make a lot of difference to your practice and you can convert as many patients as possible. In my next video, I am going to talk about how you can give the best treatment possible to your patients. What are the small changes that you have to bring in your practice and that will give maximum benefits to your patients. Please subscribe to my channel and also do comment. Take care.